Wonderful. Thank you so much. Hi, everyone. Great to see so many of you here as we talk about really the dental health, the oral care of our pets. And so first, I would like to, there we go, recognize Assisi Animal Health. They have been doing a phenomenal job educating all of us, pet owners especially, throughout the pandemic. And there's just so much to learn and to provide it free of charge. I can't thank Assisi enough. So, and thank you. I'm honored to be here on behalf of Assisi. So there's so much to talk about with periodontal disease and oral health. I tried to bring out a lot of the highlights because we're going to look at plaque, tartar, and how we can help with inflammation. But this easily could be a couple of hours talk because there is that much information to talk about. But first and foremost, I want us all to remember that periodontal disease is the most prevalent disease in both dogs and cats. And when we think about it, oral health is correlated with systemic health. So think about the mouth as a mirror to the rest of the body. And we'll talk a little bit about that. And you and I, because I am a pet owner, we are all recognizing that our pet's health, oral health, is important. And that's, seen today by so many of you attending this. When you take your pets into the veterinary hospital, the veterinary team should be flipping the lip, right? As you can see here, down on the bottom here, this dog and this cat, they should be pulling that lip up and checking the oral health, checking the teeth, checking the gums. So we should be doing an oral examination on your pets every time they come in. Okay, so if you go in and it's and it's not an emergency and you're going in for an examination, make sure that they're checking out your pet's teeth. So there will be some gross pictures too. And here is one of them. I mean, look at that. That is just nasty. We know that periodontal disease is the #1 health problem in small animals and our pets. The patients though, right? Our pets don't show, a lot of outward clinical signs. And therefore, therapy, periodontal therapy, typically isn't initiated until late in the disease. That's why it's so important for us as veterinary healthcare team members to look in that mouth, to look in the oral cavity, because as I said, it's the #1 health problem, but in companion animals, it's also one of the most undertreated diseases. Dental problems are among the top 3 pet owner concerns, right? If I were to do a mini survey, we don't have the time, but if I were to do a mini survey about dental problems, or what are your top 3 concerns, I bet dental health would come into the top 3, as I said there. And, by 2 years of age, 80% of dogs and 70% of cats have some form of periodontal disease, and small and toy breed dogs are even more susceptible. Even after teeth are completely cleaned, plaque forms on the tooth surfaces within 24 hours. And so lack of home care for 1 week can result in gingivitis, and lack of home care for 3 weeks, it will result in gingivitis for all patients. So what we need to remember is that oral health, dental health, is a combination of professional therapy. So you're bringing your pets in for what is called a dental, right? It's truly periodontal therapy, and it's professional because we can have our teeth cleaned by a dental hygienist, right? But our pets aren't going to, sit there, nicely while we scale the teeth. So the same things that we have done by our dental hygienist our veterinary technicians and veterinary nurses are doing, but it's done under anesthesia. If it's not done under anesthesia, then it's not true periodontal therapy. Because what needs to be done, you can see on this, on the left-hand side here, that's a, decent looking mouth with, clean teeth. But you can see on the right side, look at all that pus and plaque and tartar and calculus buildup. This is extremely painful. It's extremely inflamed. So we don't want our pets to get to this point. So oral health is a combination, again, of professional therapy at your veterinary hospital and effective substrate control. And by what I mean by that is there are products out there that we can, give our pets for home care to help reduce what we're seeing here and keep it more in line with what we see on the left-hand side. So a quick overview of periodontal disease, right? Gingivitis. We know that gingivitis is inflammation of the gingiva, and gingivitis is reversible. It can be appropriately treated and largely prevented with thorough plaque removal and effective supragingival plaque control. By that, I mean we can actually get under the gum and clean the plaque and tartar, thus reducing the gingivitis. Periodontitis is more severe, and that really isn't reversible. It may require advanced therapy and most definitely meticulous plaque control to prevent progression of the disease. Now, gingivitis may progress to periodontitis, and although the course is unpredictable and heavily dependent on the individual, it's known that the gingival inflammation is the first step in the development of more severe periodontitis. So here we have, some people would say, hey, that's a decent looking mouth. Well, we're seeing some plaque buildup right here. We're definitely seeing gingivitis because it's red and inflamed. Okay. Then here we're seeing more plaque and calculus. Okay. Actually, we're seeing the calculus form because plaque was not removed. That's that hard mineralized substrate that's on the tooth. And then this is actually stage 4 periodontitis or periodontal disease. And this is, many of these teeth will have to be extracted by your veterinarian. We see staining, we see lots and lots of inflammation. So I mentioned the impact of periodontal disease on systemic health. And there's a positive correlation between what we see in the mouth and changes in the heart, in the kidneys, and in the liver. Because we see all that, those couple of really nasty pictures, that's in the mouth, and that bacteria is getting into the bloodstream. And then those pathogens are spreading to remote tissues and organs. And now it's becoming more of a systemic inflammatory process. And so you saw those mouths that I showed you, right? And I apologize, they are pretty gross, but trying to encourage and educate everyone on why we should be taking our pets in. Now, also, have you seen, or do you think that with that amount of periodontal disease, is that pet in pain? Absolutely. And that pain can then affect your pet's quality of life. So we know plaque is the soft, sticky film of bacteria. It's glycoproteins, it's inflammatory cells. So again, inflammation. And it's a biofilm. And think of a biofilm as lots of different types of bacteria growing on the tooth. And it is the primary cause of periodontal disease. Now, calculus, as I mentioned, is that hard shell of mineralized plaque. And, historically, there were some veterinarians who would go in and just remove it with their, with their thumbnail. That is only getting that chunk off. That is not removing the plaque. It's not getting the plaque and debris under the gum line. So you're still going to see this, okay? And this here is gingivitis, and that's pretty severe, okay? And so it's also, calculus or tartar is also a very rough surface, and that rough surface then enhances bacterial attachment, and it acts as a local irritant. And, tartar is a rough surface. Again, that's the secondary role. So that rough surface, in addition to, damaging the tooth, providing bacteria in the mouth, it also is allowing bacteria to even more readily attach. So I mentioned staging. Hopefully when you're talking to your veterinary team about periodontal disease, they're, showing you what your dog or cat is suffering from and going through, explaining what stage they're in. Because stage 1 is gingivitis, right up to what we've been seeing, stage 4, advanced periodontitis, okay? And you can see here, the bone, really, the jawbone is just being eaten away by that bacteria. So here we see bacteria, inflammation, still inflammation, but now there's bone recession. So, I can show you all these gross pictures. I know that you guys already realize probably what this looks like, but I hope that you see how important dental health is, because we don't want our pets losing their teeth. We don't want our pets suffering from this level of periodontitis. Remember, humans typically, right, the majority of humans brush their teeth twice a day and, go to the dentist twice a year, so every 6 months. We're not seeing that with our pets. Some of you may be brushing your pet's teeth, and that's phenomenal. Thank you for doing that. Many pet owners aren't able to do that. So that's why we're going to talk about some other ways to help with that. So with periodontal therapy, what I'm talking about here is what the veterinary healthcare team is doing when you take them in for a dental, okay? And so trying to control periodontal disease, and again, that's going to be done through professional examination. So make sure, and don't be afraid to say, hey, I didn't see that you flipped the lip and looked in my dog's mouth. They'd be happy to do that and then tell you what they're seeing. And if it's a cooperative dog or cat, they might even be able to show you not everything, but show you what is going on. And then appropriate periodontal care and therapy, and comprehensive oral health assessment and treatment. And that means an assessment of the whole mouth with an oral exam and a dental x-ray as it relates to your pet's overall health and habits. And a treatment plan then is created for any problems found. And they're doing that in conjunction with you as the pet owner. Then we also want to talk about effective home care. So there's a number of at-home oral hygiene products with the goal, daily plaque control, right? Again, to control gingivitis and periodontal disease. And again, home care is just as critical to having successful periodontal therapy. So effective dental home care provides plaque and calculus control between the veterinary and the veterinary healthcare team treatments. So what I'm talking about is, we've talked about the procedures, right, where we take our pets in for periodontal therapy, but there's also products that all of us probably use on our pets to help with dental health, okay? And it's critical to helping with professional intervention. And it's essential to sustain the success of periodontal therapy. And there are so many products out there, right? I'm sure you guys feel that just as much as I do. But a lot of them don't have evidence to support, what they're stating, or to support the efficacy, how well the product works on plaque and tartar. And I'm sure it's confusing. Some of them are probably misleading to all of us as pet owners. So hopefully you realize that the veterinary healthcare team is your best resource for making appropriate therapeutic and home care recommendations. So as I mentioned, there's tons of pet oral hygiene products. Most of them are over the counter, and a lot of them don't have much evidence behind them. And so what I'm hoping that you'll look for is the seal of approval, if you will. The Veterinary Oral Health Council has a website, which is, you can see here, VOHC.org, and it lists the products that demonstrate not only the company commitment to science, but those that truly have shown that they reduce plaque or tartar, or both plaque and tartar, okay? And I know, just as you know, that the gold standard for home care is brushing, right? And I bet some of you, maybe many of you, do brush your pet's teeth. But many of our friends, neighbors, other pet owners don't. And so it can't be the gold standard if it's not used, right? So you know that I am a nutrition technician, a nutritionist. You heard that. Some of you, we may have talked before through the Sissy Webbies, and you know that diet is a big focus of mine. And so there are diets out there that can help maintain periodontal health in between veterinary periodontal therapy. Because of, studies suggest that soft foods promote plaque accumulation, but dry foods, dry kibble doesn't necessarily mean that plaque and tartar are going to be cleaned, okay? It has to be a specific dental diet, and I'll show you that, okay? Because if we think about it, those of you, and I'm one, I feed a dry kibble to my pets, and when the tooth goes into that dry kibble, the kibble just breaks apart. So at most, the only part of the tooth that's cleaned is the apex, okay? So as you can see, here we have plaque and that biofilm. So the tooth, goes into it, it just crumbles, it breaks apart. Now, there are some dental diets out there where the fiber matrix is aligned, okay? And so when the tooth goes in, it doesn't just break apart. Instead, it acts like a squeegee that goes up along the tooth and is able to get that plaque and tartar off. So here's another visual. So this is, acting as a tooth, and this is whiteout, which cracks me up because I don't even know if some of you know what whiteout is. That just dates me. But think of it as like a little white paint. And so here we have just a regular kibble, okay? The tooth, so this is acting as a tooth. Tooth goes in, and you can see the kibble just breaks apart. Whereas here we have a therapeutic dental diet. There's also some over-the-counter ones. So again, we have our tooth. The tooth goes in, and you can see it doesn't crumble like we see over here, but it actually goes in, and because of the fiber alignment, it takes that plaque, in this instance, the whiteout or the paint, right off. So this is why I get excited about nutrition. And I know some of you have already heard me get excited about nutrition, but let's keep going. So, so one of them that I'm talking about is therapeutic diet TD. I'm not promoting anything. I'm just telling you that there is evidence that shows that this helps, clean plaque and tartar in between those periodontal therapy that's being done at our veterinary hospitals. So, and there's tons of peer-reviewed research that TD is effective at controlling plaque, calculus, stain, bad odor, and gingivitis. And so here we see, controlled diet. Okay, so here we see some plaque buildup starting. We see some gingivitis and inflammation. And on the therapeutic dental diet, we can see the difference. So started with a clean mouth, like after having the periodontal therapy, and then you start them on a dental diet, if you will. And again, 25 weeks having that dental, okay, control diet, you can see stain and plaque buildup, some gingivitis, whereas the dental diet, not nearly as much. So that's just talking about therapeutic dental diets. As I said, there is an over-the-counter one. And then if we look at mechanical plaque and tartar control, right, how often do we give rawhide treats, especially those that say, for dental health? Well, if we give these here, which are aimed at dental health, again, in between our periodontal therapy, then calculus control is seen, but they have to eat 2 to 3 of these a day. And so that makes me a little nervous because of, one, that's a lot of rawhide for one dog. And also, even though it doesn't look like it, there are some calories in there. And, I get nervous about calorie buildup or too many calories. Just your regular old biscuits, and I shouldn't say it that way, just biscuits without, again, this falls into the hard food category. There's nothing special. These will not clean teeth or promote dental health. These are hard biscuits, hard treats that will crumble when the pet eats them. And then chewing devices, there's not a lot of evidence that they're effective, but I think we all use them, right? So I'm not saying to not use them. I'm just trying to show you some different options. I have some of these, but it's more to keep my dogs busy than it is to clean their teeth. So there are a ton of home care categories. So we know toothbrushing, right? We've talked about dental diets. We talked about dental chews. There are a couple of different types of dental chews, and all I ask is that you watch to see how many calories your pet is eating from those. This is another great one, one of these a day, but again, each size is going to have, different amounts of kilocalories. So the extra small is almost 27 kilocalories, and the large one of these is 128 kilocalories. So absolutely fine. We just need to, your vet team needs to make sure that they're taking these into account when they're calculating out how much your pet should eat. And then, there's plaque off powder. There's tons of things. So I go back to that oral health is a combination, again, of professional therapy, inflammatory control, and keeping the biofilm off of these teeth. It's not a once a year procedure. And as you can see, there's a ton of products and not one product fits all. So that's why I am again going to encourage you to look at the Veterinary Oral Health Council, because they are providing effective, the products that they approve provide effective plaque control between those professional interventions, which is, as we've been talking about, essential to sustainable oral health. And they have demonstrated efficacy supported by randomized, blinded, and controlled trials. The company trials are reviewed and approved by an independent council of veterinary dental experts. And the Veterinary Oral Health Council is recognized and endorsed globally. So I want you to think of it as how many of our own products have the American Dental Association seal of acceptance, right? ADA seal. This is the veterinary version of that. So the Veterinary Oral Health Council has awarded their seal for either tartar, plaque, or both. And again, go to the website and you will see what products have been awarded the seal. There's dog products, there's cat products, okay? And those will be the most efficacious to help between our periodontal therapies. Another thing, so now I've been talking a lot about inflammation. I've been showing you that inflammation, right? It is some nasty, nasty stuff. So how are we going to help with that inflammation? Well, Assisi Animal Health has introduced the dental loop. So we're familiar with Calmer Canine, right? We're familiar with the Assisi loop. Now, there's the Assisi dental loop, which is designed for use on our, dental and if they need to have oral surgery, it's designed for those patients. And it helps to reduce oral and dental pain and inflammation. We saw that inflammation, right? We talked about, man, that has to be painful. And it also helps reduce pain and swelling after dental procedures, after trauma to the face or the oral cavity. And it reduces the needs for opioids and other pain meds and aids in preparation of oral tissues. So we want to use the Assisi dental loop, again, to help our patients, to help your pets, our patients, improve recovery and decrease pain after that periodontal therapy. And, oftentimes, especially in those, grade 3 and 4 periodontitis patients, then, there may be extractions. The Assisi dental loop is going to help with that. It's also going to decrease healing time and decrease pain after oral surgery. It will help decrease inflammation caused by that stomatitis, that gingivitis, those nasty, nasty teeth, right, that we saw, and, other oral conditions. And it will also help to decrease swelling and improve tissue condition prior to oral surgery. So if oral surgery is recommended, where they might be doing flaps, which means they have to cut the gum to get rid of a tooth, or maybe to clean properly a tooth because of the level of decay. So we also know then that with the Assisi dental loop, again, using a targeted pulse electromagnetic field signal to deliver microcurrent to damaged tissue. And it's precisely tuned to trigger animals' natural anti-inflammatory process. The electromagnetic signal stimulates cellular repair. That's why I love these things. And biological effect of induced current makes it a functional therapeutic component. And again, it helps to enhance nitric oxide, the body's own nitric oxide, which has biotherapeutic effects. So it's peer-reviewed, right? Many experts in the veterinary field not only use it, but they endorse the targeted pulse electromagnetic field therapy because it is enhancing the patient's own nitric oxide production, which is a big part of the healing process. So we covered a lot of information. We covered a lot of, what is periodontal disease? How do we help manage it? How do veterinary teams help your patients, your pets to feel better? And what can we do in between, dentals or periodontal therapy? And what can we do to help reduce that inflammation that we saw in those images? So remember, pets need dental care too. They don't brush their teeth twice a day. I mean, some of you may brush your pet's teeth, but the majority of cats and dogs out there don't brush their teeth twice a day. And, unfortunately don't have twice a year, dental checkups. So something for us to think about. If we can't brush our teeth, let's check the Veterinary Oral Health Council website and see what products are out there that can help decrease plaque and tartar in between visits. Thank you very, very much.